Hello everyone, I'm Beverly Labajo and I'm going to present narcotics, opioids, and non-opioids. Types of opioid receptors and their mechanisms after activation. Types of opioids receptors have been discovered. Number 1, mu receptor. Number 2, kappa receptor. And 3, delta receptor. Opioids receptor are G-protein coupled receptors. They mediate the human body's response to most hormones, neurotransmitters, drugs, and are involved in sensory perception, vision, taste, and olfaction. All all G-protein coupled receptors consist of 7 transmembrane spanning proteins that couple to intracellular G proteins. Mechanism of actions. Opioid agonists produce analgesia by binding to specific G protein coupled receptors that are located in brain and spinal cord regions involved in the transmission and modulation of pain. Clinical effects. Opioid drugs typified by morphine and have the potential to produce profound analgesia, mood changes, physical dependence, tolerance, and hedonic effect, which may lead to compulsive drug use. Opioid drugs act in both the central and peripheral nervous system. The adverse effect of opioids: respiratory depression, nausea and vomiting, constipation, urinary retention. The contraindication of the major classes of opioid analgesics. Contraindications: use of pure agonists with weak partial agonists. 2. Use in patients with head injuries. 3. Use during pregnancy. Non-opioids. Non-opioids analgesics include non-steroidal anti-inflammatory drugs or NSAIDs, selective COX-2 inhibitors, and acetaminophen. NSAIDs inhibit cyclooxygenases COX-1 and COX-2, thereby disrupting the production of prostaglandin, an important mediator of pain and inflammation. Clinical effects. Possible side effects include kidney problem, liver problems, nausea, vomiting, constipation. The adverse effect of non-opioids: nausea, vomiting, constipation, numbness, and tingling in mouth or lips. Contraindication: gastroduodenal ulcers, renal failure, recent myocardial infarction, unstable angina, heart failure. Surgery discontinue NSAIDs 1 to 3 days prior to surgery. Avoid NSAIDs during pregnancy. Tolerance, dependence, and addiction of opioid analgesics. Tolerance and independence. With frequently repeated therapeutic doses of morphine or its surrogates, there is gradual loss in effectiveness. This loss of effectiveness is donated tolerance. Tolerance, although development of tolerance begins with the first dose of an opioid, tolerance generally does not become clinically manifest until after 2 to 3 weeks of frequent exposure to ordinary therapeutic dose. Dependence. The development of physical dependence is an invariable accompaniment of tolerance to repeated administration of an opioid of the mu type. Addiction. The euphoria, indifference to stimuli, and sedation usually caused by the opioid analgesics, especially with injection intravenously, tend to promote their compulsive use. Opioid drugs include opium, codeine, fentanyl, heroin, and hydrocodone. And that's all.